New tonight, we often hear about how expensive childcare can be and the decisions parents must make between sending their children to daycare or staying home to defray those costs. But what many of us don't plan for is spending our savings taking care of our parents. Surveys show this is a cost more than 30% of Americans are not saving for. News 4's Teresa Weekly looks into how expensive long-term care can be.
Hey, Bridget, 336 needs assistance.
Donna Bird Swain is a full-time nurse at Sisters Hospital in Buffalo.
About 5 years ago, she was diagnosed with the moderate cognitive impairment.
She didn't plan on taking care of her mother and the emotional toll that comes with it.
Sometimes, you get a little tired, and then it's like you still have to do certain things, like before going to bed, I have to prepare her for bed, and those kind of things.
If you end up having to pay for a parent's long-term care, it can be financially devastating.
Nothing can impact a retirement nest egg like a healthcare concern.
Forget the fact that nearly half of all families don't have any retirement account savings. People in their early 50s who do save have less than $130,000 in their accounts, according to the Economic Policy Institute. Nursing homes in Buffalo cost an average of $113,000 per year. So you could wipe out your entire retirement account in 13 months. Assisted living facilities in Buffalo can cost nearly $4,000 per month. This is an issue financial advisor Robert Pawalski brings up to even his younger clients.
What is the best way to prepare for it? Is it to put money in savings or to get some type of health insurance or long-term care insurance?
It's different for everyone. It depends on the assets that you've accumulated. But we're always proponents of transferring that risk onto the shoulders of an insurance company.
The premiums for long-term care insurance can be high because most people over 65 end up needing to use it. Donna is fortunate that her mom, Esther, qualifies for Medicaid. It covers the cost of a medical day program for adults at the Catherine Labouré Center.
People who are maybe isolated at home that don't get out very much, this program is great because they can get therapy and they can also have nursing if they need blood sugars done, wound care, anything like that, but then they can socialize with the group.
Home health care is another avenue that can help you keep your mom or dad out of a facility. Interim Care of Western New York is one of the agencies that offers this service.
I think their biggest concern is the affordability and also the fact of a lot of people don't want someone coming into their home. So that's where we help them because we skill match the caregiver to the patient's likes, interests.
The national average for a home health care aide is $21 per hour. That could add up to more than $6,000 a month if you don't have insurance. Donna's mom uses her Medicaid to cover the cost and prefers not to think about what comes next.
Don't want to think about it, but think about it. And I think that's the part that sometimes the reality of all of this kind of sets in when I have to think about it.
For now, she enjoys the moments she has with her mom at home.
She'll ask me every now and then, what's going to happen to me? I said, Mom, you're just going to keep on living. I said, every morning God blesses you to see the day. We just going to keep going with it.
Financial advisors say another option is to put a rider on your life insurance. You can use some of the death benefit to cover long-term care costs. But the most important thing is to have the conversation now about care for your parents and eventually for yourself. In Buffalo, Teresa Weekly, News 4 at 6.